like to understand more about the ministry's response to the recent sentencing judgment in Mr. Ong Beng Seng's case, because in the judgment it was actually found by the sentencing judge that, as mentioned by the SMS, SPS has an adequate healthcare system to manage inmates with complex and serious medical conditions in conjunction with the public healthcare institutions, but that does not address the enhanced risks of potentially fatal infections and falls. So based on what SMS said earlier, does he accept that there's no way that the prisons can actually address this concern of the courts with regard to potentially fatal infections and falls? Second question is, I'd like to have his affirmation that in the public interest, the law should apply evenly to everyone, and there should not be any perception that ill health is seen as a license to commit crimes and escape punishment.
So we have medical care protocols and in place a healthcare system that can manage inmates with varying conditions. And I work very closely with the prison, and I've come across many of such cases, and including those with serious and complex medical conditions, such as those requiring dialysis, active chemotherapy and radiotherapy, stroke or post-operative care. And also, we have established infection control protocols in place that are aligned with standards practice in the PHIs. And healthcare staff in SPS also adhere to infection control standards, such as observing all the different protocols. And practically, you find the standards very similar to what you can get outside. And we also have negative pressure cells that for infection control, like for example COVID or even tuberculosis to the extent. So, and ours is not something very different from what you see outside. So we will continue to make sure that we provide the necessary standards, healthcare standards to our inmates.